So this exercise is a way to help your family member or your partner, whoever is in a lot of pain, suffering from either acute disc bulge in their back, sciatica down the leg, piriformis syndrome, anything where they feel that their back is being compressed and squished down, especially if they have a desk job or if they've just recently developed this pain. Essentially, all you're going to do is relax their entire body just down on the bed. Then what you're going to do, you're going to stand, keep your legs sort of around hip width apart. So you're just going to stand like so, about hip width apart, slightly bent at both the hips and the knees. Keep your back straight to protect yourself as well. Then what you're going to do, hold your partner's ankles. Now make sure you don't have any injuries, of course, and their ankles are okay to hold, just above their ankles, sorry. More so on the shin and around the base of their calf. Then all you're going to do, sit down as you are. So you're just going to sit down and then lean back, keep your arms nice and locked, keep things nice and locked, and then they're just going to pull like this, and you're just pulling on their legs, which is just going to help alleviate and decompress their lower back, like so. So I'm just leaning back, I'm not pulling with my arms, I'm just grabbing, leaning backwards, using my body weight to protect myself, and then you're just going to stand back up, let go of the legs, and relax yourself back down. And that should help just decompress the discs in their back as well as the joints and the vertebrae, just decompress and stretch everything and help to alleviate their symptoms. If they're getting benefit from this, then you can repeat it 10 times, as many times throughout the day as you'd like to. So for example, up to 15 times a day, which is a lot, but especially if they're suffering from an acute episode on a day where they can't get to see someone, this can be very useful. The last thing you can do, especially if they're having a lot of pain around the pelvis, is just to stretch out the front muscle around here of the hip, which is a psoas muscle. So what you're going to do is get your partner just to come slightly off to the side. So just come slightly off to the side, that's it. They're just going to drop their right leg, for example, on this side. They're just going to drop the leg down off the bench towards the floor, just like so. You're going to hold them in place. So you just have one hand here. The other hand, you're just going to push down at their knee, just like so, and they'll have a stretch at the front of the groin around the hip area just here. What you're then going to ask them to do is push their knee upwards towards the ceiling. So if you push your knee upwards towards the ceiling, just about 50% of their force, and you're just going to resist with your hand, and then tell them to stop, relax, drop the leg down, and you're just going to push their knee downwards again, giving them a further stretch in that hip. You can perform that with a push for 5 seconds and then stretch for 5 seconds. Repeat it 3 times and see if they benefit. The next thing you can do is a bit of a skin pinch and hold. So if they're suffering from pain travelling down the leg, down the side of the leg, for example, which is their sciatic pain, then all you're going to do, take your thumb and your index finger, a bit of a pinch and a bit of a lift away from the bone. So imagine you're pulling the top part of the skin away from the bone underneath, and that just helps decompress the layers underneath and helping the nerve pain there as well. So you're just going to pinch the skin, grab it and lift it away from the bone. And you can do that all the way down the leg. Essentially try not to nip your partner or your friend, whoever you're helping, just a bit of a skin pinch and a pull, pinch and a pull. Very gentle.